Hey everyone and welcome. This is Francesca from Social Work Portal. Anxiety disorders are one of the most common mental health illnesses in the U.S. And generalized anxiety disorder, or GAD, affects about 6.8 million U.S. adults. But over half go without treatment. So today's session is all about how to screen for anxiety. We'll cover spotting the signs of GAD, choosing the right anxiety assessment tool, administering and scoring the GAD-7 questionnaire, and building screening into your ongoing practice. So let's get started. So step 1, knowing what you're looking for. A lot of people ask about the difference between anxiety and generalized anxiety disorder. And honestly, it comes down to scale and persistence. Everyone worries sometimes, but GAD is worry that's disproportionate, constant, and hard to switch off. Once you notice that pattern in session, that's your cue to move to a standardized generalized anxiety disorder screening tool. Here's some signals to watch for. Being restless or on edge. Trouble concentrating. Muscle tension. Being easily fatigued. Irritability. And sleep disturbance. So now that you know what you're looking for, step 2 is picking the right anxiety screening tool for your needs. The GAD-2 is a fast 2-item version, perfect to use during intake. When a client scores 3 or higher on it, that's your signal to follow up with the full GAD-7. The GAD-7 itself is the industry standard. 7 items take about 2 to 3 minutes. And it's the one you'll use most often for a complete severity picture. But it's worth knowing a few options beyond these two. The GAD-Q-IV maps more directly into the diagnostic criteria. The Hamilton Anxiety Rating Scale gives you a broader, clinician-administered symptom picture. And the Penn State Worry Questionnaire zooms in specifically on pathological worry. These are all clinical anxiety screening tools worth having in your back pocket. And knowing when to reach for each one is what separates an efficient assessment process from a clunky one. You can learn more about all these assessments at socialworkportal.com. Step 3 is about actually giving the GAD-7 in a way that gets you honest, reliable answers. A few small things matter here. Tell your client you're only asking about the last 2 weeks, not their whole life story. That framing alone helps reduce a lot of anxiety about the assessment itself. Reassure them that there's no right or wrong answer. Give them a quiet moment, whether that's a paper form in your office or a digital intake form they'll fill out before a session, so they can actually sit with the questions and not feel rushed. If you're consistent in how you introduce this every single time, clients trust the process more, and you'll get cleaner data to work with. You'll also want to make sure you collect all 7 responses in the GAD-7 to ensure you can score it accurately. If you're using digital forms, you can do this by making each question required. Step 4 is where the numbers come in. GAD-7 scoring is refreshingly simple. Every item is worth 0 to 3 points. You add them up for a total between 0 and 21. Scores of 5, 10, and 15 are the dividing lines between mild, moderate, and severe anxiety. So it helps you get an instant severity read without complicated math. And here's a stat worth remembering for your own confidence in this tool. In a 2006 validation study, a GAD-7 score of 10 or higher identified generalized anxiety disorder with 89% sensitivity and 82% specificity. That's published in the Archives of Internal Medicine if you'd like to look it up. Now, each score range has a recommended action. 0 to 4, minimal anxiety. Monitor and reassess as needed. A score between 5 and 9 indicates mild anxiety. Monitor and support. Between 10 and 14 is moderate anxiety. This is when action is recommended. And the highest scores between 15 and 21 indicate severe anxiety. And the recommended action is seek professional help. Now, it's important to know that the GAD-7 is a tool. It helps clinicians recognize the potential for a diagnosis of generalized anxiety disorder. It's not a diagnosis itself. Diagnosis can only be done through clinical follow-up. Now, this next part is actually my favorite step because it's where the tool actually changes what happens for a client. A score of 10 or higher doesn't mean you diagnose GAD on the spot. It means you dig deeper. Let me tell you about Maria, a client referred to a community mental health program after months of unexplained fatigue and constant worry about her kids, her job, her finances. Typical things we all worry about from time to time. Her clinician gave her the GAD-7 at intake instead of relying on a quick 5-minute check-in. And her score came back at 16, solidly in the severe range. That score prompted her clinician to move her follow-up appointment up and loop in a psychiatric consult that same week, instead of just the usual month-long wait. The score didn't replace the clinical interview, but it flagged the urgency that the team might have otherwise missed during a busy caseload day. That's the real value of structured generalized anxiety disorder screening. It helps you triage attention where it's needed most. Step 6 is about turning a one-time assessment into an ongoing practice. A single GAD-7 score is just a snapshot. But if you re-administer it every 4 to 8 weeks, you start seeing a trend line. And that trend tells you whether treatment is actually working. The key here is consistency. Use the same tool the same way across your whole team. So a score means the same thing no matter who's collecting it. This is also usually the point where organizations start feeling the administrative weight of tracking all this by hand. Spreadsheets, paper files, notes that don't talk to each other, it can all mean more work than necessary. And that's the perfect segue into how to make this whole process sustainable, which is exactly what we're covering next. So let's bring this process all together and put it on autopilot. You can do that with a case management software such as Case Management Hub. Here's an example. First, use the free GAD-7 template. Then, when you're adding a new client, send them the GAD-7 along with any other intake forms. They'll be able to sign up for a free client account in seconds, fill out the form, and submit it back to you. They can even do it from their smartphone. Once you receive their form submission, take a look. And if needed, schedule a task to follow up with them in 4 to 8 weeks. You can even set up a task reminder to remind you a day or two ahead of time. So if you want to check out the Case Management Hub for yourself and grab a free GAD-7 form template, sign up for a free trial today. It's free for 21 days, no credit card is needed. Just click the link in the description. You'll find multiple assessment templates to use, form reports, goal tracking, and a whole lot more. Thanks so much for hanging with me and watching my video. If you like this type of content and want to learn more about social services and nonprofit tools and resources, like this video and subscribe to our channel. You'll never miss one of our new exciting videos.